Ever wondered what passive movement is and how it works in physiotherapy? Today, we're going to unravel this concept for you. Passive movement, in a nutshell, is a type of physical therapy where the therapist moves a patient's body part rather than the patient doing it themselves. This is often used when a patient is unable to perform movements on their own due to pain, weakness, or other physical limitations. It's a crucial aspect of physiotherapy, aiding in rehabilitation and recovery. In this video, we'll be diving into the nitty-gritty of passive movement. We'll explore its different types, understand its role in patient recovery, and even discuss why it's such an essential tool in a physiotherapist's arsenal. From joint mobilization to continuous passive motion, we're going to cover it all. So, ready to dive into the world of passive movement? Stay tuned as we break it down for you. First things first, what is passive movement? Well, let's break it down. Passive movement, as the name suggests, is a type of physical movement that involves the muscles being moved without any effort from the patient. Instead, the movement is facilitated by an external force. This could be a physiotherapist, a piece of medical equipment, or even a gentle breeze on a summer's day. Imagine you're lying in a hammock, eyes closed, gently swaying back and forth with the rhythm of the wind. You're not doing anything to create that motion, right? It's all the wind's doing. Passive movement is a lot like that, but it's a bit more targeted. This form of movement is a cornerstone of physiotherapy and rehabilitation. It's often used when a patient is unable to move a particular body part due to injury, surgery, or certain health conditions. By moving the muscles and joints passively, we can aid in the recovery process, stimulating blood flow, maintaining muscle tone, and even helping to reduce pain and swelling. Now, don't confuse passive movement with its active counterpart. Active movement is when the patient initiates and completes the movement all by themselves. It's like when you decide to get up and walk to the fridge to grab a snack. You're making all the decisions and your body is following your commands. Passive and active movements, while different, are both crucial components of the recovery process. They're like two sides of the same coin, working together to restore mobility and strength to the body. Understanding passive movement is key to grasping the full scope of physiotherapy and rehabilitation. It's more than just lying back and letting someone else do the work. It's about aiding the body's natural healing process, promoting recovery, and improving overall quality of life. Now that we have a basic understanding of passive movement, let's delve deeper into its types. Did you know that passive movement isn't just one size fits all? It actually comes in different types. Indeed, there's a whole spectrum of passive movements, each with its unique purpose and benefits. Let's explore some of them. First off, we have continuous passive motion, or CPM. As the name suggests, this type of passive movement involves the continuous movement of a joint using a machine. You see, after a surgical procedure or a severe injury, a joint might become stiff or immobile, and that's where CPM comes in. It helps to gently move the joint, promoting flexibility and preventing stiffness. Imagine waking up to a sun salutation, a gentle stretch that greets the morning. That's what CPM does for your joints, keeping them active and flexible. Next, we have pendulum exercises. Picture a pendulum swinging back and forth. It's the same concept here, but instead of a pendulum, we're talking about your arm or leg. These exercises are typically used when dealing with shoulder or knee pain. They help to reduce swelling and improve range of motion. It's like a soothing swing for your joints, easing them into mobility without exerting too much pressure. Now, let's move on to manual stretching. This is a type of passive movement where a therapist manually stretches the patient's muscles and joints. It's like having your personal trainer, but instead of pushing you to lift weights or run laps, they're helping you lengthen and relax your muscles. Manual stretching is often used to improve flexibility, reduce muscle tension, and increase range of motion. It's particularly useful for patients recovering from injury or those with conditions that limit their mobility. But wait, there's more. Other types of passive movement include joint mobilization, where the therapist moves the patient's joint in specific directions to improve function and mobility. Then, there's passive range of motion exercises, which involve moving a joint through its full range of motion without the patient's active involvement. It's like taking your joints for a joyride, exploring the extent of their flexibility and movement. Each type of passive movement has its unique role and function. Some are perfect for post-surgery recovery, others for managing chronic conditions, and some for general wellness. It's like having an arsenal of tools, each designed to perform a specific task. The key is in knowing when and how to use each tool effectively. In the grand scheme of things, these types of passive movement are not standalone solutions. They are part of a comprehensive and personalized physiotherapy program. They work in harmony with other treatments and exercises, aiming to restore the patient's mobility and improve their quality of life. Understanding these types of passive movement can be key in tailoring effective physiotherapy programs. So, whether you're a patient seeking to understand your treatment plan or a budding physiotherapist, recognizing these types of passive movement can help you understand the mechanics of recovery and rehabilitation. You might be wondering, why is passive movement so important in physiotherapy? Well, let's dive into that. Passive movement, as we've established, involves the therapist moving a patient's body part without the patient's active participation. This can be a game changer in the realm of physiotherapy. And here's why. First off, passive movement can help prevent stiffness. When a body part remains static for an extensive period, it can lead to what we call joint contracture, a condition where the joint becomes rigid and its range of movement is limited. This is where passive movement steps in. By gently moving the affected joint, it can help keep the joint flexible and reduce the risk of contracture. Secondly, passive movement aids in maintaining joint mobility. Picture this. You're recovering from a leg injury and your leg has been immobile for a while. Passive movement can assist in keeping the joint mobile during the recovery phase, which is crucial to regain full function of the limb once you're healed. Let's not forget about circulation. Passive movement promotes blood flow to the muscles and tissues around the joint. Improved circulation means better nutrient supply to the tissues, aiding in faster healing and recovery. Now, while the benefits are numerous, it's also important to note that passive movement is not a one-size-fits-all solution. It might not be suitable for patients with certain conditions, such as unstable fractures or severe inflammation, as it could potentially cause more harm than good. Moreover, passive movement is often used in conjunction with other therapeutic techniques for maximum benefit and should be carried out by trained professionals to avoid causing any discomfort or injury to the patient. In the world of physiotherapy, passive movement is not just about moving a limb. It's about enabling the body to heal, recover, and regain function. It's about improving the quality of life for patients who might be struggling with movement due to injury or illness. Indeed, passive movement serves an integral role in patient recovery and rehabilitation. We've covered a lot today about passive movement. Let's quickly recap. Passive movement, as we've explored, is a term we use in physiotherapy to describe the process where a therapist or a device moves a body part without any help or resistance from the patient. It's a technique that is as intriguing as it is beneficial. We dived into the different types of passive movements, each with its unique purpose and benefit. There's passive range of motion exercises, or PROM, where the therapist moves the joint through its range without muscle contraction from the patient. This is often used to maintain or increase flexibility and joint health. Then we have continuous passive motion, or CPM, where a device is used to continually move the joint after surgery. This helps to reduce swelling, improve joint recovery, and prevent stiffness. And let's not forget about passive stretching, where the therapist stretches the muscle group while the patient relaxes, which can help improve flexibility and alignment. We also discussed the importance of passive movement in physiotherapy. It's a powerful tool that can aid in the recovery process after injury or surgery. It helps to maintain joint flexibility, prevent muscle stiffness, and promote blood circulation to the affected area. Not only does it have physical benefits, but it also has psychological benefits, such as reducing anxiety and promoting relaxation. But remember, while passive movement has its advantages, it's not a one-size-fits-all solution. It's a part of a larger treatment plan, tailored to the individual needs of each patient. In conclusion, passive movement is a cornerstone of physiotherapy that plays a crucial role in patient recovery and overall health. It's a fascinating field, and we're just scratching the surface. Thanks for joining us in this deep dive into passive movement. Don't forget to like, share, and subscribe for more informative videos like this.